The time suck for healthcare professionals is about to get worse. I'm talking doctors, nurses, anybody that has to record things for healthcare. The last time doctors sat out developing technology that they would start using every day, they got the behemoth called the electronic medical record, which is now taken up most of their day. So the electronic health or medical record was developed for hospitals to be able to track billing and profits and what things were being done to the patients so they could bill more efficiently and extract as much profit as they could. In 2015, doctors were told and hospitals that it was a requirement that they use an electronic health record, specifically in order to be reimbursed by Medicare. And of course, everyone else jumped on that as well. That's led to physicians spending over 50% of their time on administrative tasks instead of doing what they were trained to do in medical school, which was treat patients and interact with them. This week's cover story on Newsweek is talking about artificial intelligence potentially being the cure for physician burnout. And my first thought on that is it's not physician burnout, it's physician abuse. Physicians and nurses, especially in the past 4 years, but going back prior to that little pandemic thing, have been experiencing PTSD. Quoted in the article is a guy that talks about soldiers experiencing these issues, time constraints, mental health issues, having PTSD, and doctors that have this type of strain and stress having burnout. However, studying AI use among doctors actually increases the amount of time that physicians spend on charting. So they're already spending 50% of their time on administrative tasks. Adding another 22% would just make the whole problem worse overall. And of course, doctors cannot reach out for help. Those that do wind up in front of medical boards where they get sanctioned or they're put on probation. They're enrolled in forced mental health programs, physician health programs, where they're monitored and drug tested for 5 years just for asking for help. 71,300 physicians retired or left practice in 2021 and 22. So that's 6% of the physician workforce. So if physicians do not engage in development of AI technology, it will be forced upon them. About 33% of medical practices had a physician retire last year. So the physician shortage coming your way.